Okay, I want to talk about cleanliness, super cleanliness. If you're going to do hemodialysis at home, your home's got to be real clean. And the biggest issue is in possible infection. Okay, and see, I typically my energy level on a day-to-day basis, usually 80% of the time I am good, and even on the bad days I'm pretty good, a little tired, but I go to the treadmill, I go to the gym, I walk on the treadmill. Within 10-15 minutes my blood is flowing, I feel better. And we're in September now. Last month, I had an issue. I went a full week with fever. It just wouldn't break on its own. My energy level was low, and my dialysis nurse told me to go to the ER. So I go to the ER, and fortunately, I only live 10 minutes away from a hospital. I get in, my temperature was like 102. And so they immediately put me in a bed, and they scanned my chest, and it turned out I had pneumonia. Yes, last month, and I had pneumonia. I spent 5 days in the hospital, and when I got out of the hospital, they gave me 30 days of antibiotics to take, which I still have about 3 days left of antibiotics. And so, pneumonia is a common thing in people who do dialysis. Okay, so but the things you can control is keeping the home clean, getting no infection, because that's how a person would feel if they got an infection. They would just feel so sick. And I do go to a public gym, so I'm around people, in close proximity to people. And one thing I recently learned, I can't believe the dialysis clinic never told me this. Never take medication right before doing dialysis. Never, because it just defeats the purpose of the medication. The dialysis is going to clean out your blood. So try to take, now I'm talking right before dialysis. So I typically do dialysis 4 or 5 in the evening. If there was any medication I had to take in the morning, I would take it. But fortunately, the only medications I take is just at night, so I do it right after dialysis. That way, the body, I will get the best effect of it. And this month, since I had the pneumonia, I have been feeling really well. And so again, gotta keep your place real clean. I have a little dog here, and so I take him out almost every day, and I give him a bath every day, and because he's walking where other dogs do their business, so I want his feet, his body clean. And I mop the floor every other day, and I'm shocked at the amount of dust and dog hair I have on the floor. And see, this is just a little short-haired dog. He's not hairy at all. And so the dialysis clinic will give Clorox wipes. Use those things. Wipe your machine down at least once a week. At the minimum, once a week, wipe it down. Wipe down your seating area. Like I said, I'm just sitting on a sofa here. It's like a leather sofa, so I kind of wipe that down. My table, my coffee table. Wipe down your devices. I always have my tablet. I like to watch and read. And so, but my energy level prior to getting pneumonia, it was almost 50-50. But at that time, I was taking my meds right before I did my dialysis. And when I was in a hospital, they said, no, don't ever do that. And so I listened. I take my meds post treatment. So I noticed this past month, since I've had pneumonia, it's been about a month now, and I've been feeling really, really well. And another thing that's going to keep you energized is to have something to do. When you wake up in the morning, you want to look forward. I make my plan at night. Oh, what do I want to do tomorrow? And so I think about it, and so it gives me a reason to get up. And like, I go to the gym every day. I get some exercise, and almost every day. I didn't go yesterday. I wanted to get my full body rest because I'm 50 years old, exercising every day. It's my muscles stay sore, but I like it. I enjoy it. So, but yesterday I was really busy doing a repair on my car and watching a YouTube video doing a repair, and I got it done. So that would probably take a professional 30 minutes. It took me half the day. So taking my time, using hand tools, not power tools. So I always have something to do. I own this condo, so I'm always doing something to kind of fix it up a little bit. So anyways, energy level, several months ago, leading up to pneumonia, it was kind of 50-50. And then, but I spent 6 days in my house with high fever, and I should not have waited that long. People can die from pneumonia. And so, but I think before that 6 days of fever, I recall feeling kind of bad, like the 2 weeks coming up to that 1 week of fever, just prior to me going to the ER. So the energy level, exercising is the best thing. There's been many times I've went to the gym and my energy level was low, but the first thing I do is get on the treadmill. And I'm not saying run like a horse, walk, whatever, 2-3 miles per hour. And you'd be surprised. And within 20 minutes, it's like the blood in your body starts flowing. That's the best thing I recommend to overcome low energy. And in many cases like that, I sleep very well that coming night. So that's a positive thing. And so when I wake up and I'm feeling kind of tired, I just already know in my mind, oh, I'm gonna sleep so good tonight. Because my mind, once it gets daylight, I wake up, and it just wakes me up. I get excited, and that's just the way I am. Probably growing up in the country, farm, and wake up with the daylight, and it's kind of still in me now. So anyways, I hope this video helps you on energy level. The biggest complaint for a lot of kidney disease patients is difficulty sleeping. Okay, I need assistance to go to sleep, so I'm prescribed 2 medications. Alprazolam 2 milligram tablet. I take one of these, and trazodone 100 milligram tablet. I take one of these. So one of these together at the same time, that works for me. And I'm just relaxing. You want to be relaxing, and at this time it's like I take these at 10:30 at night, and I'm just sitting here, the TV is off, and I'm just have my tablet, I'm watching YouTube short videos, and I feel myself, I'm in that relaxation mode. And I do that every night, 10:30. I got my alarm set, take these meds, that 30-minute wind down, sometimes 45 minutes, 11:15, and I go to sleep. So if you can go to sleep, if you can, at the same time, that's really, really, really a difference maker. So anyways, I hope this video helps you. Have a good day, and thank you for watching. Take care of yourself. Be positive and fight. I'm going to overcome this. I will. And you will too, if you have your mind right. Have a nice day.